Hello, my name is Franz Brinkmann, and I'm a gastroenterologist in training at the University Hospital in Dresden. I would like to thank GIE for giving me the opportunity to share some insights from our recently published paper entitled Anchoring Fins of Fully Covered Self-Expanding Metal Stents Effect Pullout Force in Stent Migration. Fully covered self-expanding metal stents are often used for biliary stenosis, given that, in contrast to uncovered stents, they show a very low risk of tissue ingrowth. Stent migration, however, is a common challenge with fully covered stents that can lead to clinical complications such as cholestasis and cholangitis with the need for an unscheduled ERCP. To limit stent migration, several mechanical stent features were developed. For example, stents with anchoring fins have outwardly bent wire structures with a PTFE layer to hold the stents within the bile duct, while another design approach is to widen the ends of the stents to prevent migration, which is called flared ends. However, during our daily use, we observed that some types of fully covered stents seem to show higher migration rates than others, while previous studies reported that the presence of anchoring fins seems to be associated with low migration rates. A direct comparison of adverse events associated with flared ends versus anchoring fin stents has not been performed yet. In this study, we aim to compare migration rates of different fully covered self-expanding metal stents and to identify a biomechanical parameter that predicts migration resistance of different stent designs. We hypothesized that anchoring fins increase stent migration resistance and reduce stent migration and potential adverse events. To test our hypothesis, we investigated different biomechanical parameters of stents and observed that the pullout force of the stents predicted migration resistance. Stents were inserted into a 5 mm soft silicone tube and mechanically pulled out with the required pullout force measured. Here we found that stents with anchoring fins required a 4-fold higher pullout force compared to the stents with flared ends. Regarding the clinical part of our paper, we conducted a retrospective analysis of all patients who received a fully covered self-expanding metal stent for distal biliary stenosis between 2016 and 2022 at the University Hospital of Dresden. All patients for whom we did not have follow-up information were excluded. Overall, the analysis included 129 patients with 178 stent placements, of which 80 stents had anchoring fins and 98 flared ends. There were no significant differences in patient and stent characteristics between the groups with anchoring fins and flared ends. Coming to the clinical results. Of the 80 placed anchoring fin stents, only 5% migrated during the observation period of 180 days, while within the flared end group, the migration rate reached 34%. These highly different migration rates were also reflected in the number of required unplanned ERCPs. In the anchoring fin group, 15% of patients required an unplanned ERCP for stent dysfunction, while in the flared end group, this was required in 29% of all cases. Cholangitis was seen in 5% of the anchoring fin stents and in 19% of the flared end stents, showing a significant difference. The Kaplan-Meier curve for stent patency showed that the area under the curve was significantly different, with the anchoring fin stents having higher patency weights compared to the flared end stents over the time. So, what does our study add to the existing knowledge? We found out that fully covered self-expanding metal stents with anchoring fins are associated with lower rates of stent migration, lower rates of unscheduled ERCPs, and lower rates of cholangitis compared to fully covered self-expanding metal stents with flared ends. Furthermore, we identified that the pullout force is a reliable biomechanical marker to be predictive of migration of fully covered self-expanding metal stents. Finally, I would like to give a brief outlook on the next steps. The pullout force as a potential predictor of stent migration should be investigated in the context of established biomechanical stent parameters such as axial and radial force. In this regard, further prospective studies are required to confirm our findings. Regarding the stent patency, we analyzed that the first 180 days after stent implementation for the anchoring fin stents to ensure comparability between the different stents. The next step would be to collect long-term data on stent patency for the anchoring fin stents. If you find our paper interesting and informative, we invite you to share your thoughts and comments through social media or the corresponding address. I would also like to thank everyone who has been involved in this project.